SB43, Expansion of Grave Disability, Field Observations. This video presented by the San Bernardino County Department of Behavioral Health explores SB43 and the expansion of grave disability. It is shared with us by Jewish Family Services Patient Advocacy Program. We're going to go over what we're calling observations. Observations are essentially layperson terms that are not the law, but what we're hoping to do in conjunction with other counties and in working in collaboration with law enforcement is to build what we hope to become a community standard around some layperson observations that would make it easier to decide in the field whether someone is meeting the new definition of grave disability. The new definition of grave disability now includes concepts like severe substance use disorder, personal safety, and necessary medical care. The legal definition that are provided are helpful, but they're also very clinical. The goal of this video is to provide what we're calling observations that can be used by non-clinicians out in the field. A reminder that these are not the law. We're trying to develop a community standard that's consistent across the community. All right, let's talk about some observable considerations for grave disability due to mental health disorder or a co-occurring substance use disorder. These include things like the inability to articulate a plan for food, clothing, or shelter, irrational beliefs about food that is available or offered, for example, poison, the inability to engage in personal hygiene due to mental health symptoms, refusal to utilize food, clothing, and shelter when offered resources, urinating and defecating on oneself, impacted speech, rambling, difficult to understand, for example, word salad and catatonic or blank stare, and some additional observable considerations for grave disability due to a mental health disorder or co-occurring substance use disorder include things like violent or threatening statements, fluctuation between calm and agitation, creating a public disturbance, yelling obscenities, screaming, paranoid or delusional thought content, disorganized thought content, and hallucinations, talking to, hearing voices, and responding to unseen others. A reminder that the definition provided by the new law for severe substance use means a diagnosed substance-related disorder. That means the diagnostic criteria of severe as defined in most current versions of the Diagnostic and Statistical Manual of Mental Disorders. That's a technical legal definition. However, it's unlikely that we are going to expect law enforcement in the field to be using clinical terms and making a diagnosis. That's one of the reasons we decided to make this video, is to try to come up with some observations that people in the field could use that are non-clinical, but will allow them to decide cumulatively what makes someone potentially able to be detained by 5150 under the new definition. And lastly, let's talk about observable factors to consider for grave disability determinations for severe substance use disorder. These include things like overwhelming odor of alcohol or marijuana, dilated or constricted pupils, bloodshot or watery eyes wide open or droopy, heavy-lidded, nodding off, an unsteady gait, slurred speech, the inability to walk or stand by oneself, somebody who's fumbling simple tasks, scratching, picking, or clawing at skin, for example, noticeable sores on the face, hands, or arms, multiple patterns of contacts for a similar presentation intoxication in a 12-month period. These are just some of the examples of observations that we are working with our partners to develop. For a longer list, a more thorough list, please see the QR code on this slide, which leads you to our website, which has a list that can be printed out and can be used in the field. The list will be ongoing and developed as we continue working with our community partners and as the community standards continue to develop. For more information and for more feedback, please reach out to our website by using the QR code. Thank you.